Hi, everyone. On today's podcast, we're going to talk with Dr. Kimarie Bugg about her work to address breastfeeding inequities in the African American community. Hi, everyone, and welcome to today's episode of the Evidence-Based Birth Podcast. Today, we are so honored to have with us Dr. Kimarie Bugg. Dr. Bugg is President and Chief Institutional Officer of Reaching Our Sisters Everywhere, or ROSE, a national nonprofit created in 2011 to address breastfeeding inequities in the African American community. And Dr. Bugg is a career perinatal and neonatal nurse professional. Kimarie has spent nearly 4 decades working in the Atlanta metropolitan area and nationally promoting perinatal health, breastfeeding, and community-based impact solutions. Previously, Dr. Bugg worked in private pediatric practice and for Emory University School of Medicine as a nurse practitioner, at the state level as a perinatal nurse consultant, and in the hospital on inpatient pediatrics, in the Pediatric Emergency Center Special Care Nursery, and as a bedside breastfeeding consultant from 1986 to 1994. In 1987, Dr. Bugg became the first African-American International Board-Certified Lactation Consultant, or IBCLC. Dr. Bugg is a member of the faculty for Boston Medical Center's Community and Hospitals Advancing Maternity Practices, known as CHAMPS, a baby-friendly hospital initiative, and a past board of directors and chair of the Ethics Committee of the United States Breastfeeding Committee. Dr. Bugg is known nationally for her work in lactation, anti-racism and health equity, the nonprofit world, and marginalized community empowerment. She has received innumerable awards and recognition, including multiple Lifetime Achievement Awards. Dr. Bugg provides health equity through breastfeeding engagement, training, education, and resources for providers, lactation providers, and community transformers nationwide. Dr. Bugg is an adjunct faculty currently for Morehouse School of Medicine, Pediatrics, and we are so excited to welcome her to the podcast. Welcome, Dr. Bugg. We're excited to have you here.
Thank you so much. I am really happy to be here.
I was wondering if you could take us back a little bit before we move to present day and tell us about, what inspired you to go into lactation. You were the first African American to become an IBCLC. What inspired you to go down that journey, and how has the field changed since then, after you tell us about your beginnings there?
Okay. I love to talk about the past because I feel like we have come so far. It is really amazing. But as many people, birthing people, women, mothers, it happened to me through trauma. In 1978, I became a registered nurse. I became an MRS, and I also became a MAMMA. During that time, I had a set of twins in 1978, and I was away from my family, born and raised in Indiana. I was in Texas because that's where my husband and I were in school there. And I had absolutely no one to help me with breastfeeding my twins. First of all, the twins were a surprise. And then I was reaching out to the community to find someone who could sort of give me some information because, again, I had grown up watching folks breastfeed, but not breastfeeding twins. And so that was sort of a shocker to me. And at that time, we had telephone numbers that indicated where you live. And of course, I lived where people like me live. And everybody knew, again, from your phone number where you were. And so I never received a phone call back from the folks I reached out to. Because, again, La Leche League was about the only folks we could contact at that time, or that I knew of who was in the community doing breastfeeding support. So I felt like I failed miserably. And I decided that when I went back to work, which was in an inpatient area in a hospital, that the families that I served were not going to be as miserable as I was trying to and failing at breastfeeding my children. So I feel like I did not have the information and the resources, and there was no one for me to reach out to. So I, at that moment, started being the one that the community and the mothers who I worked with in pediatrics could count on for some breastfeeding information.
Wow. And that is just like a story, like you said, it happened to you, but I'm sure it's happened to many other African-American mothers during that time period. And you said your twins were surprised, meaning you didn't know that you were pregnant with twins?
Right. And I'm not surprised that you don't understand that, because at that time we didn't have sonograms and all of those things. So no, what we went on is signs and symptoms. And I had a phenomenal OBGYN who was telling me, because at that time I was a nursing student during my pregnancy. And I kept saying something's wrong with this baby because this baby moves 24 hours a day. And so my OB just told me, look, you're not even a nurse yet. I'm the doctor. The baby's okay. So at the end, actually 11 days before they were born, my visit, he felt one great big head at the top and one great big head at the bottom. And so sent me for an x-ray, which is probably as tall as I am, that then showed the two babies.
Oh, wow. That's back then.
1978.
Yeah.
Were you born in 1978?
I'm not going to say exactly what year, but I will say my dad was a surprise twin as well. Yeah. So my grandmother was pregnant with what she thought was her sixth child and ended up being her sixth and her seventh. And apparently they should have known she was pregnant with twins because she got so large by the end, she carried them all the way to 40 weeks and she couldn't get up out of the recliner.
Well, yeah, and I was too. But, what happens, especially with when you've had some, you get larger each time.
That's true.
So
it's hard to tell. It's hard to tell. And yeah, so that's really fascinating because I don't hear that many surprise twin stories anymore. And what was difficult or different about breastfeeding twins? So you said you saw people in your community growing up in Indiana breastfeeding?
I did. Okay. And it was all just, kind of normal to see that. But again, it's different when it is your own, again, especially when it's your first. And parenting in general is just different when you're doing it for the first time. But I was, again, if I had been in Indiana, and again, they didn't know many people who were breastfeeding twins, but I'm sure we could have found some folks. I would have had the village around me to help figure that out. But I had none of that where I was. And again, like I said, nobody calling me back to say, hey, we can help you. Even my mother came to visit, and I was a breastfed child. My mother breastfed me for a while, but she came to visit me, and her position was that this was too difficult of a task for her baby. And so she actually was advocating with my husband that, this was too hard for me to do because, again, we weren't getting any assistance. And, I had all those things, the sore nipples, obstructed ducts.
Right.
Totally overwhelmed with lack of sleep. And so they didn't have the information to be helpful either at that time. So it was, a calamity of errors. But I just want to say, I can go on and say now, because you look sad. That problem was fixed because in 1991, I had another set of twins and they weaned on their third birthday.
Oh my goodness. 2 sets of twins.
Right. I said that, God gave me that second set to fix the breastfeeding problems I had the first time.
Yeah. Sometimes, like you said, our own trauma and challenges can inspire us to go help other people so they don't have to experience the same thing. And I know you mentioned, being a nursing student in the late 70s, and that's when my mom was a nursing student as well. And she was in Kentucky, and she remembered the first, African-American nurse that was hired around the same time she was hired. So you were kind of entering nursing at a time when it was just barely starting to be desegregated, correct?
Well, I would say, that is how it was in the South. Again, I was from Indiana, and there weren't very many registered nurses of color where I was either. But right after that, when my babies were a year old, I moved to the Atlanta, Georgia area. And that's where we are today. It was like, phenomenal. My eyes were just, wide open because there are so many Black nurses in the area. Now, they had just gone from, several segregated hospitals to integration, again, around that time. I moved here in about 1980. But the Atlanta metro area, major cities, the Detroit area, Chicago, those are places that I had relatives that were nurses. And that's one of the things that sparked me to want to be a nurse too. But yeah, it definitely was not a lot of nurses in rural areas for sure, but in major cities, yeah.
Yeah. And then going into the field as an IBCLC, so you did that in 1987. And what was that experience like?
So again, most of my adventures and journeys are definitely been a story. There was the Surgeon General, C. Everett Koop, was advocating for breastfeeding early 80s, late 70s. And they decided to give funds to all 10 public health regions. So the Atlanta area being, sort of the hub of Region 4, they came to Atlanta to have a meeting and announce these grants. So myself working at a large inner city hospital, and at that time in administration as, charge nurse, decided that this was something I really wanted to do because after I learned about breastfeeding, the places I worked at sort of deemed me the breast nurse, all of the hospitals I went to after that, because I was one who was reading and learning information so that I could help others. And that's how I had to get it, by reading and getting resources myself. So our hospital applied for one of those grants and got it. And what we chose to do was to have what we call a bedside breastfeeding counselor. They wanted to name it all types of other things, but we didn't want to because we wanted the folks to understand what it was that we did. This hospital, Grady Hospital in Atlanta, was probably about 85% Black, 10% Latina, and then, 5% other. So I became the first bedside breastfeeding counselor. My boss had just come from a conference, and this was in 86, the end of 86. And he said, I just came from a conference where they talked about this board certified thing. I want you to go take that test. So that's how it became a thing for me. That was the end of the year. And in 1987, I think it was April, is when the exam was. So, I got some information and studied, took the exam, had no idea really what was going on with this. But I knew many of the people who were writing the exams and doing the process. So I did reach out to them and talk to them about things. And so I took that exam and, it was pretty amazing at the time because Grady Hospital was the first one to have a bedside breastfeeding counselor. All the other hospitals in the area sort of looked at us and said, well, if Grady can do it, we can too. And so after a year later or so, all the other hospitals started to have what they called lactation consultants. And at one hospital now in the city actually has about 45, lactation consultants on their staff now. So we've definitely come a very long way as far as that is concerned.
And in terms of like what was happening in the 80s with breastfeeding, it's my understanding that this was they were trying to bring breastfeeding back. Like it had kind of gone away in the decades before. Formula was heavily emphasized. And so now we were trying to re-educate people about breastfeeding. And you're saying you were the breastfeeding nurse, all the nurses look to you as well, Kimarie knows what to do, because it wasn't necessarily included in nursing education.
So it was not included in nursing education. Absolutely not. It was not included in nutrition education. Physicians were only taught how to fix broke breast. So no, as far as healthcare providers are concerned, no one was really teaching about breastfeeding. Now, you did get some information about the components of breast milk.
Okay.
and, how it worked in that mammary gland. So that is all that we learned in our professional education.
Mm-hmm.
And again, it's not a whole lot better today. It is much better than it has been, because one of the things that we did, especially early on with training and education, especially of healthcare providers and public health providers, is to ask, I'd be in a room with 300 people. How many of you were trained in lactation in your professional training? And, you'd see 2 hands go up. Now, the majority of the folks feel like they did get some information in
Some
their
basic info.
trainings. However, we don't know what that is yet. That might still be one class because it's not showing in the community.
Yeah. And I know when I was having my babies in the 2008 to the 20 teens, I still was running into doctors who thought the cure for everything was to stop breastfeeding. Wow. I can't tell you how many times I was just, well, you should just stop, because it's causing this or it's causing that. Like they thought breastfeeding was causing problems. And I was like, did you study this in medical school? And my hunch was no.
Absolutely not. And again, that's one of the things that, we've had the opportunity to do, especially in the Metro Atlanta area. This is a very rich area for civil rights and many things, the Atlanta metropolitan area. So being African American and doing breastfeeding in the community, we had the opportunity to really meet a lot of those icons and actually work with many of them and their families and their lactation problems. That really helped us to really position ourselves to where we are today, because, knowing the Dr. David Satchers and the Andrew Youngs and the Vivian, so all the people that we were able to meet, the Hamilton Homes, and those are, really sort of big icons here. But, they had problems, their families, their wives, their children had problems with lactation and breastfeeding also. And we had with ability a lot of these times to do home visits and really get to know folks. And that made a difference for us. But yeah, there was very, very little to help with breastfeeding. And, one of the things during that time, we also got a grant to spend some time in San Diego, which is the San Diego Lactation Program, and meet a lot of folks who have definitely, written the books and write the articles and all those things, and learn different strategies to push it forward. Dr. Audrey Naylor, who is someone that I consider my mentor mom, was absolutely amazing. I had spent much time with Dr. Ruth Lawrence. And I mentioned Dr. David Satcher, who is the 16th Surgeon General of the United States, and he was here at Morehouse Medical School for many years, and he helped to mentor us. So during that time, we really learned a lot about how to encourage and advocate for breastfeeding in the African American community.
Mm-hmm. So in terms of overcoming challenges, can you talk about maybe what are the most common challenges that anybody can face with breastfeeding, regardless of their background? And then we'll move into some the more unique challenges for the African American community. Is that okay?
So workforce is a big problem in this country. We keep saying that we want women to breastfeed exclusively for 6 months and then, past a year and past 2 years. But exclusive breastfeeding is a financial burden to a lot of families. If you are able to have that time off, a lot of times it's not with the same pay. If you have other children, that, you need to provide for and take care of, it can truly, truly be a huge burden. Childcare costs are extremely expensive these days. So again, a lot of jobs don't even provide 6-month leaves. And if you do take that 6-month leave, you make it paid for 3 months. And so then you get not paid for those other 3 months. So that is a burden. That's a burden. That's one of the things policy-wise that we just truly, truly got to work out. And then, the types of jobs a lot of folks have, and that's one of the unique challenges for African-American families, may not provide even, those 3 months of leave. It's difficult to get a lot of companies to actually have lactation rooms and provide time for women, birthing people to actually go and spend time to be able to pump and even save the milk for their babies. So that's some of the biggest problems is lack of resources, not having supportive lactation support providers available to help that are affordable. And then actually for them to get paid, because so many of the people I know that works in my community actually provide services free on sliding scales and free. It shouldn't have to be like that. Folks should be able to get paid for their service. And, when I started again, I had so many people on my couch coming to my home, to my couch sitting that I would help with breastfeeding. And I might get a rotisserie chicken, they may bring, a rack of ribs or, some vegetables from their gardens. And that was my pay a lot of times. And it still seems like it's a lot now. I was just talking to 3 young lactation support providers yesterday who were all saying that they do a lot of their work free. They have jobs where, they're doing what it is they need to do, but then they work on their own doing home visits and calling and telehealth, and a lot of those things are free. And, these are not well-off people.
Right. And it just kind of shows like how our society doesn't really value parenting and motherhood and with dollars. Like it's like not valuable enough for us to actually pay someone to help you. And when I think of breastfeeding challenges, I think of like milk supply issues or sore nipples or all of the things that make your life as the parent miserable or difficult or feeling like a failure. And then I love how you're looking at the systems and being like, there's no one to support you. Like these are all fixable issues or issues we can address at least. But you have to have people who know how to support you. And so the workforce.
In fact, the CDC says about 60% of women do not reach their breastfeeding goals. And those are some things that could tremendously be fixed if there were enough lactation support providers and easy access to be able to get to those folks. So, because I could fit breastfeeding into your lifestyle. If I have a conversation with you and you say, oh, well, I can't do this, or this is what I can do, I can help you to solve those issues. But, if you don't have someone to get to be able to help you do that, then, and then you got all these other folks on the other side saying, yeah, there's too much trouble. We got this new scientific formula. You could just give them that. And it's almost the same, which is pure lie and fabrication, but that's what they get. I had a client, actually family member, who this is her 3rd child, and she was exclusively breastfeeding, took the child for her 2-month visit. Now she's exclusively breastfeeding for 2 whole months. She gets in there and it's a new pediatrician, and she was going to a practice where, her other children went, but this was July. In July, the new residents are just graduating and they're starting their practice. So in pediatric practices, they usually give the newborns to the newbies because, you get to develop a relationship with them, as they grow up. So this new pediatrician in July, she's brand new, tells my family member that her 2-month-old skin is dry and that she's probably allergic to something in her milk and she should stop breastfeeding for a while till they find out what's in her milk that the baby is allergic to. And so it just so happens again that this person, who is my family member, and this is her 3rd child, and she'd exclusively breastfed, for 18 months and longer with the first 2, thought it was hilarious and just laughed hysterically. And just told her, I know you, and that was when the show Ashton Kutcher was out called Punk was out. Mm-hmm. She's like, where's Ashton? He has to be here. Tell him to come out of the closet. And she just laughed and laughed. And she said, finally, and the woman was trying to tell her she's serious. And so she finally said to her, well, I tell you what, you do what you have to do to find out what's going on with her skin, but I will not breastfeeding. But can you imagine if she had said that to someone who had exclusively breastfed for 2 months, and she goes there thinking they had done phenomenal job, and then the physician says that to you? She could have totally destroyed
Like you're hurting your
that.
baby with, yeah. So what ended up happening? Did they figure it out?
Oh, yeah. Yeah. I mean, first of all, her other children have eczema. So it wasn't difficult. We could have told them that. We knew that. We've been seeing that baby for 2 months. We know her little skin was dry. Moisturize it. That's all she needed. So she was fine. She was growing.
I would go back again to the cure is to stop breastfeeding is like what they teach or something in medical school. I don't know. So can you talk about your work at Rose and just tell us about kind of a little history of that and what you all do at Rose?
Okay. So yes, started again because so many folks who look like us was just not having problems. So many of the lactation support providers that I knew who were, not labeled that at these times were doing the same thing we were doing, or I was doing, is having folks come over to your house and you're helping them with their breastfeeding. So we said, why don't we put something together so we can do this? And so we did, and it was just overwhelmingly just nationally, folks saying, wow, this is amazing. And one of the first things we did was a summit. And at our summit, we wanted to make sure that this flowed like a Black family reunion. We wanted everybody there that touches babies. So we actually had, physicians and social workers and nurses and mothers and babies and doulas and midwives and off the entire spectrum there. And nobody had titles. Everybody's just, their first names. And it went extremely well. We probably had 200 people there. And we call them summits because we always do an action plan at the end. So at that summit, we worked together and actually did a mission and vision and goals, again, with physicians, with mothers and babies, all in the room together. And it just so happens that the Kellogg Foundation people were there, who we had no idea because we did not know these folks. And they, at that time, offered us a grant to work nationally. And that was our very first year getting started. So it was just, it could not have happened in a better way. And that funding that they gave us at that time really helped us to put together a national directory of who is where and what they're doing. So we were able to, find folks in New York who were doing lactation support. And then there have always been people out there doing things, but everybody always felt they were doing it all by themselves. So that was one of our biggest things, is to create a network so that if someone in New York calls and says, hey, can you come here and teach us, this about breastfeeding? We can say, hey, there's someone right up the street from you and with Stork and Cradle. Give her a call because she does the exact same things we do. And she knows your geography. She knows what's happening in your state. And so we have, been able to do that all of this time. We've done African American breastfeeding blueprint to see we did lots of listening sessions. We call this the State of Black Breastfeeding, to see what was happening. Brought people together again from all over the country, included the HBCUs, the historical Black universities and colleges, to talk with them and see what's happening in communities. And then we put together a blueprint. One of the things we found out, that was 2019, is that about 20% of Black women were stopping breastfeeding every week. And the reasons for that was little things like sore nipples, going back to work, and not having pumps. And so we put together initiatives to make sure that these folks had somebody they can talk to for at least 8 weeks. Because what the research again showed us is that the rates of dropping off got better after 8 weeks. And so we did what we called a breast friend program, where we would connect someone who was successful with breastfeeding for at least 6 months with someone who was pregnant and having a new baby. And they would just mentor them through those first 8 weeks, and we'd give them a stipend. And that has been very successful. So little things like that, a Rose Community Transformer trainings to help folks so they can just help folks in their communities, making sure that we present at lots of conferences and workshops and community forums. We've also put together a fatherhood initiative, ROBE, Reaching Our Brothers Everywhere. And they have been absolutely phenomenal with working specifically with Black men to help them to equip, empower, and educate Black men to protect breastfeeding. They actually, are just sought after a lot more than we are these days. And we're really excited about that because Black men were just really feeling invisible in this space. It's maternal child health. Where's the place for them? And then even going to the hospitals with their significant others, having the babies, they felt that people just totally ignored them. And so, their job is to help Black men not feel invisible in these spaces. And they're really doing a phenomenal job. They've had some training and they call themselves doulos now. Instead of the doulas, they're doulos. And again, they are there to help the fathers to fit into and get the resources they need to make sure that, that breastfeeding is supported, and also just birth and, the risk factors that Black women go through having babies too. We work a lot with baby-friendly initiatives nationally, and that really has made a difference for us. We feel that, again, a rising tide can float all boats. Policy makes a difference, especially for nurses. If you telling the nurse to do something and they're going to ask you, where's the policy? You can say, okay, the policy says so-and-so, and they'll do it, even if that policy is not there. Policies are something we grew up on as nurses. So baby friendly, insist on policies being made. So that makes a difference. We work very closely with the Academy of Pediatrics, the Academy of Breastfeeding Medicine, which are mostly physicians, American Public Health Association, to make sure that breastfeeding is embedded into what's happening in public health nationally. We've been on the expert work groups again for Baby Friendly USA for many years when they're updating and looking at different things. And in fact, speaking of a long time ago, Baby Friendly in the United States started around 1990, 1991. So I was one of the first to do assessments in the hospitals with Minda Lazaroff, who was the first executive director. So, it went way back for me and Baby Friendly. I actually went to Manila to see the very first Baby Friendly hospital and spend some time there. That was one of the other grants that we got. So Baby Friendly is really important to us. And again, it truly makes a difference in how people are treated. It makes a true difference in equity. So we are promoting that. There are some issues these days, as it is with everything, but it really is a great initiative to work with.
Yeah, and I want to encourage our listeners to go to breastfeedingrose.org, click on programs and see a lot of the programs you mentioned, like the Breast Friends and the Community Transformers, which looks like it's like a 2-day training for people to learn how to support people with breastfeeding. And then I also wanted to ask you, you have a program called the Queen's Circle for grandparents. Can you talk a little bit about healing generational trauma and how important that is in the African American community?
Oh, well, it definitely is. And, we missed out on many generations who did not breastfeed. Now, Black women have always breastfed, but because of generational trauma and racism, there have been periods where, a lot of times they may not have been breastfeeding their own children. They may have had to, breastfeed master's children. So that is definitely traumatic. And that's why one of the major things that we do is to talk about why breastfeeding is important, not just beneficial. Because again, you have to work with what we can to get over the trauma.
And can you talk a little bit more about what do you mean the difference between why it's important versus why it's beneficial?
Black women die, 4 or 5 times more than white women with breast cancer. So it's important for us to understand that breastfeeding can help, you live longer. It decreases diabetes. It, protects against osteoporosis. All of these things, Black women have a much higher risk factor for. Even, obesity, all of these things. It's not just beneficial, it's actually important to your longevity. There are risks to formula feeding. And those are that's some of the ways we're changing the narrative. Instead of just, breastfeeding is beneficial and important, there are risks of not breastfeeding. So those are some things that we also talk about now, as opposed to just, oh, this is wonderful, this is why you need to do it. Because there are challenges, there are barriers, but it is important to work through those, again, because you can live longer.
Mm-hmm. So both for your longevity and then also for the survival of children as well. I saw that you do a lot of work in NICUs. Can you talk a little bit about that?
So, yeah, in NICUs, it's become a much easier spot because physicians in NICUs, the neonatologists, definitely use human milk as a medication. They very strongly advocate for mothers of sick newborns and preemies to provide breast milk. And just those words from those providers really helps women to provide breast milk for their infants. And then if there's not, at this point, they can get donor human milk. So, that is something that has definitely evolved over the years. But neonatologists have always been huge advocates for human milk feeding. So we are extremely happy about that. We are sort of, disappointed with community pediatricians, again, because there's so much that they could do to make a difference. Just having a lactation support provider in their offices, because again, you're in the hospital 2 days, 2 to 3 days. You're in the community, 360 of those days left that you want to at least make it up to a year. And that's where the problems and issues and concerns are. So if pediatricians had a lactation support provider, even, 2 days a week, a Tuesday and a Thursday, come in for 4 hours and bring their lactating patients in to see them at that time, that could make a huge difference in this country. Mm-hmm. That's one of the things we're advocating for, not, because we don't expect pediatricians to spend 45 minutes with a lactating mother, and it's going to take that a lot of times early on. And that's why they're working on these lactation support providers, like Morehouse School of Medicine has a training that they call the perinatal navigator, where folks for 20 weeks are trained as a community health worker, a doula, and also a lactation support provider. And we provide the lactation training for them. Rose does, and Health Connect One does the doula training for them. And they've been in that space for a while, and they're doing phenomenal. And then they also have that other training as a community health worker. That is a perfect sort of lactation support provider that wouldn't cost, what a nurse costs, to come in 2 days a week to do lactation support training. Also, training doulas will make a huge difference because 90% of their clients do breastfeed. And so a lot of times they aren't able to help them sustain breastfeeding, but they start. So those who start are, low-hanging fruit for getting them to continue if they have the resources they need. And we say a lot of times that our community is resource deprived because they just don't have the information they need to go forward.
Mm-hmm. Wow. I feel like I'm talking to a living legend. Your organization has done so much work. It's so incredible. I was wondering, is there anything else you want to talk about that's on your mind, or looking towards the future, advancing breastfeeding equity, or anything else you want our listeners to be thinking about?
So the major thing is workforce. Again, we have got to have enough people to be available to give accurate information. I've been told for so long from mothers that if you ask 5 nurses, 5 physicians, 5 public health professionals, the same question, that you're going to get 15 different answers. So we need consistency from professionals. There is something called an interprofessional educational module that the folks at Boston Medical Center did, and it is phenomenal. It's for 7 different disciplines, and it's consistent, wonderful information. And I'll send you the link to that, and it's free. Anybody can do it free. Now it's basically for lactation for physicians and nurses and dietitians, and there are pharmacists there and public health providers, but it is wonderful, consistent little information that is wonderful. And we just need to have more things like that to make sure that we're giving consistent information, because that confuses parents when, they're getting 5 different answers.
And you mentioned, training for listeners who are maybe doulas, a birth worker who doesn't necessarily have the time or resources to become an IBCLC, which can be quite extensive, especially if you don't already have a nursing license. What would you recommend are some of the first not easy, but maybe the best ways to kind of just gain some basic info so that they can help their clients troubleshoot some basic concerns?
Yeah, so let me say that there are lots of lactation support providers, and what we consider, there's beginning levels, there are intermediate levels, and there are expert levels. There are, WIC peer counselors are phenomenal. They have changed the landscape of America. Truly, they have been phenomenal. Then, our ROSE community transformers, and we've trained folks in 39 states. There are certified lactation counselors, the certified lactation educators. There are the IBCLCs. There are breastfeeding medicine physicians who are the expert level. The Academy of Breastfeeding Medicine has many, and we have access to them. If I have a problem or issue, we're always making sure that we have levels to refer to. So I've seen some things that I hadn't seen before, and I definitely call my breastfeeding medicine physicians. Dr. Allison Stubbe is one of those who is phenomenal. And so from the peer counselor, everybody doesn't need a cardiologist. Everybody doesn't need an IBCLC. You can, may just need somebody to rub your back and say, you got this, you can do this. Peer counselors are phenomenal at that. And so we need that workforce to include all of these folks. The doulas don't have time either to spend a whole lot of time, but if they can get the moms over that acute problem and then refer them to a lactation support provider, then that would be phenomenal, because they have that captive audience, folks seeking them out, and they do wonderful work with what they do. So that's one of the things we are focused on now, spending time with training doulas, because doulas are definitely a hot commodity right now, and we love it.
If you're a doula and listening, just remember that Dr. Bugg said you're a hot commodity.
Yes.
So, and I love the advice to look into becoming a peer counselor first as a great first step into helping support the community.
Yes.
Well, thank you so much, Dr. Bugg, for just letting us pick your brain about your incredible career and all of the things you've seen and helped with. And we really are just excited that you're here, and I hope our listeners learned a whole bunch of new things from you today.
Thank you so much. There's nothing I love better than talking about this, and definitely serving the community. So thank you so much for having me.